Hi, welcome to your Module 8 um, tutorial for your WWCC Nursing Assistant course, NRST 1510. We're getting close to the end of this course, so hopefully you've been caught up or getting there. So let's go over a few reminders. Reminders, again, make sure you're caught up on all your modules. Remember that all of them have to be done to have completion of this course. It is to meet the hour requirement that the state requires for any CNA. So our course is 45 hours of theory time. So all the modules and introduction tests, everything like that, are added up to those 45 hours. 19 hours of lab and 16 hours of clinical. Again, those are required by the Wyoming State Board of Nursing. Also, if you haven't done so already, get your vaccinations and CPR to your teacher. That means clinical is right around the corner. And again, if you have not turned that in, which was required before you started this class, that you have made special arrangements with your teacher and she knows about it. Again, your grade needs to be above 75%, 75% for all your assignments, and then 75% for just your tests. So the quizzes, the actual classwork, not the module tests, that's 75% module test, and your final is another 75%. So just be aware of that. If you haven't done so throughout the course, make sure you're checking your email and your announcements frequently. Remember, it's in 2 different sites, so unfortunately they don't link together because we don't want Health Center 21 to have access to all the Western Wyoming software grades. We have too many classes going on, so of course they have their own software. We have our own software. So make sure that you're checking your email and announcements frequently. So for Module 8, it's Nutrition and Elimination. We're going to go over all these submodules in Health Center 21. So when you're going through, making sure that you're taking notes and understanding the information. Diets and elimination are very important, and there is some skills that you need to know, and we'll practice a few in lab. So the submodules are optimal nutrition, diet, feeding patients, input and output, assisting with toileting, urinary catheters, and special bowel elimination procedures. So when you go to the optimal nutrition subunit, it is going to discuss how nutrition is important for everyone's bodily functions. Without nutrition, we wouldn't survive. So our bodies depend on nutrients. They also depend on minerals and vitamins and water. We have to eat certain food groups and stay healthy, and not only because we'll gain weight, but also our body and our cells won't duplicate, they won't reproduce. So we have to eat appropriately to make sure that inside our body, the stuff that we cannot see, is taken care of as well. So when it starts going over nutrients in this section, nutrients are the carbohydrates, which are the simple and complex. Simple sugar, that's how I remember it. Complex are starches. Lipids, that's your fats. They're found, the saturated fats are found in animals. They're solid at room temperature. Trans fat are the oils. They're liquid, then they turn solid. And unsaturated fat is liquid at room temp, and they don't ever harden. Even the true peanut butters, they'll have the thin layer of liquid at the very, very top. That means that's a really good peanut butter and healthy for you. It contains more unsaturated fats. Proteins, they help build and repair and maintain your cells inside your body. Vitamins, there's fat soluble, which are A, D, E, K, and water soluble, which is C and B. B's. Minerals are your calcium, phosphorus, iron, potassium, sodium, and magnesium. And of course, water stands on its own, and it is essential for life. We cannot go very long without our water. You need to drink as a human being 6 to 8 glasses of water a day, and that just maintains an equal balance. Food groups are also important to know for this optimal nutrition, so you can teach your patients and clients what they should be eating. So, of course, you want to go by the food guide pyramid, and we have grains, vegetables, fruits, milks, meats and beans, oils, and fats, which is very sparingly. We also want to limit that sugar and salt in our diet. A great resource to learn more about your food groups and how much you should eat per serving is located on myplate.com. It's a great resource if you've never looked at that. So diets, it's not just being on a diet. We're talking about diets in general when they're in a facility, whether long-term care, even if they're at home and they're put on special diets. So this section goes over that. A regular diet, if you hear that, they're not on any restrictions. A soft diet is easily digested food, so soups, cheeses that are mild, crackers, toast, juices, milk, cream, butter, cooked cereals, white meat, jello, pudding, and plain ice cream. That's just some of it. There is more. I just kind of threw some together. Health Center will go over more. If someone's on a liquid diet, there's a clear liquid and a full liquid. Clear liquid diet is seen more when people are going to go have like a test done when they're in the hospital, or they're on trying to calm down their intestines or something like that. So just be aware when they're on a clear diet, the liquids need to be transparent. You need to see them. So broth, that's chicken broth or beef broth with no noodles in it or anything like that. Tea, coffee, juice, water, just stuff like that that you can see through. A full liquid diet is when we start adding stuff into it to see if they tolerate that well. So that's all liquids, which would be milks, orange juice. I'm trying to think of another. But also then you'll add some foods like cream of wheat or oatmeal, some soups with noodles, pudding, plain ice cream, butter, honey, and syrup. And that's just some. You'll see another list when Health Center brings that up. Patients do have to progress through the diets. Say they're admitted because they had some intestinal problems going on. Maybe they're started on ice chips. They would progress from ice chips to water, ice chips and sips of water to clear liquid, then to a full liquid, then to a soft diet, and then lastly a regular diet. We want to see that progression, which they're tolerating and not throwing up, or maybe any other issues occurring from advancing their diet. Therapeutic diets, I didn't want to make this video too long, so Health Center will cover all of those. It's just going to talk about no added salt, cardiac diets, different types of diets, a diabetic diet, so you understand that we would limit sugars or salts in certain people's diets. Okay. Other considerations when we put people on special diets is maybe their age. For sure wouldn't be giving a T-bone steak to a 6-month-old. So you would be age appropriate, culture appropriate. Some religions don't eat pork, so we would make sure that they didn't have that on their tray when they're admitted to our facility. Religion, again, same kind of thing. Personal choice, again, they just might not like something. Maybe they have allergies. We have a lot of gluten allergies building in our community because of processed foods and things like that. So there's a rising gluten allergy for sure. And maybe other health conditions are going on that will require them to have a special diet. Okay, so when you're feeding a patient, there's a lot of stuff to consider. You're not just in there to feed the patient. People depend on meals as also a social aspect. That's when we go and talk with our friends or family. A lot of people don't like eating just alone. They'll even turn on the TV set to have some noise if they are alone, just to have some kind of social aspect going on while they're eating. Nurse assistants usually do serve the trays and assist setting up, making sure that they have a chest protector on their chest, they have their silverware in place, whether they're sitting at a table or staying in their bed. A lot of times, even if they are up as tolerated, it would be nice to even get them out beside their bed in a chair with a bedside table. The more movement, the better. So if you are a nurse assistant is a feeding a patient, of course you want to set them up and make sure that you're interacting with them, that you're face to face and that they can see you. You don't want to stand above them, makes them feel like you have power over them, and you want to be at their eye level. They also eat better when you praise them and not go in ugh, this smells disgusting. You want to be like, oh gosh, this is delicious. I can't believe how good it tastes. Be very positive with that. Also, watching the resident patient for aspiration issues occurring. That is maybe the food's going down the wrong tube is what we call it. So I know everybody's heard that at one point or another throughout their lives. So aspiration precautions, we don't want it going down in their lungs. We want it going down their esophagus into the stomach. Okay? After every meal is complete, the nurse assistant will usually chart that meal. Depending on what program and what the nursing staff, dietary staff wants you to chart. Maybe caloric intake, maybe carbohydrate intake. Maybe it's just the percent of the intake that the person ate. Milliliters of their fluids that they drank. Maybe they even have a supplement, which you would have a different total from their regular fluids. And anything else required. Enteral nutrition, that is usually a nutrition that is delivered specially to them through a tube, whether a G tube or NG tube or a J tube. Again, the Health Center 21 will go more in depth of the tubes. Remember, when you are doing any of these feedings or you're watching them and you're notifying the nurse of any changes that might be going on with the patient. The nurse is administering it because it is a medication, and she's taking care of all the tubing and things like that. So you're not messing with the pump, you're not messing with the tubing, you're not adding any more formula to the bag. So just be aware and work within your job scope. Input and output, when you're trying this, you want to maintain a homeostasis. That's a balance. I always think that what goes in must come out. So if your patient's drinking about 1,000 cc's of fluid, then of course she needs to be putting at least 1,000 cc's of fluid out. If she's putting more, there might be something going on. If she's putting less, it would indicate some issue going on as well. So we're always charting and notifying the nurse or your supervisor of changes that are occurring. For adults, a healthy amount per day of water or fluids is 1,500 to 2,500 milliliters a day. Again, you want to make sure that whatever's going in is coming out. Reporting any abnormal signs, some dehydration, sunken eyes, their skin isn't rebounding as fast, their mouth looks dry, and they don't have a lot of spit. Maybe they're also the other way, they're having fluid excess, which are swollen in their legs or their abdomen or maybe even their genital area. So you're reporting that. Maybe they haven't had any urine out during your shift. So check your tubings all the time. Make sure that they didn't go to the restroom without assistance. That happens quite a bit, and we think that they just didn't have any urine. So make sure that you're also investigating before you report. When assisting someone to the toilet, you're checking out their urine and their bowel movement. You're making sure that their urine is clear yellow. If there's anything else abnormal, make sure that that's reported to the nurse. Bowel movements, you're looking at the size, the consistency, if it's a change from before, and notifying the nurse again of any changes. Encouraging water, especially if the person seems to be a little constipated. Okay? If the patient does require any equipment to assist them with elimination, please make sure that you know how to work that equipment and that you prepared yourself before going in. Also, a lot of times in long-term care facilities or home health, we're trying to retrain that patient's bladder. A lot of times we have a restorative department that takes care of that planning. However, the CNA on the floor would be the one initiating that. And a lot of thought goes into those retraining. Urinary catheters is a tube that is put inside the bladder to drain the urine out, whether it's a straight catheter, indwelling catheter, or a common catheter. Remember, during this, you're not putting any of that in, you're not doing any of the actual procedure. Remember to work within your scope. The nurse assistant is observing the tubing, the amount, the color, making sure the tubing's never kinked, and reporting any changes to the nurse. You should be draining your urine bag every 8 hours. So that's usually if I'm on shift and I know I just got on, I would go check that as soon as I got there to make sure the previous shift emptied that. and then empty it again at the elimination. Special elimination procedures. This is usually because the person has an ostomy, which means they have a colostomy of some sort, a bag over a stoma. So if they had a surgical procedure to create an ostomy, a stoma is the outside. It's a little beefy tissue of their intestines going on, and it's kind of unique. And hopefully I'll show you the stoma on our mannequins. It's not truly what it looks like, but it'll give you an idea of what what you can expect. But the waste comes out of those stomas and is expelled into a drainage bag of some sort. It is a CNA's job to take that bag off every 8 hours, empty the bag into the toilet, and chart appropriately. When doing so, you're not messing with the actual stoma or the wafer. That's the part that goes around the stoma. That is your job description. So make sure you know what you can and can't do in each state. If you notice anything's different, reporting that to the nurse. That was a really quick overview. I know all these modules are getting long, but that was as quick as I could go. I know the module does cover more than what I covered. But if you have any questions at all, please give your instructor a call and let us know if we can help you. Have a great day.